Good day, everyone. Thank you for giving me the time to speak today. As the Chief Diversity and Inclusion Officer, part of my responsibility is to ensure that our organization delivers care that is equitable, respectful, and aligned in our mission. Today, I want to share a focused overview of culturally responsive health care and patient advocacy, two areas that directly influence our quality outcomes, patient trust, regulatory compliance, and long-term organizational success. What is culturally responsive healthcare? Culturally responsible healthcare is the practice of providing care that aligns with the patient's beliefs, values, and lived experience. This is not simply a courtesy, it is a clinical and operational necessity. When our teams understand how culture influence a patient's perception of illness, communication preference, or trust in the system, we deliver care that is safer, more effective, and more aligned with national quality standards. As leaders, our responsibility is to ensure that every patient, regardless of background, experiences care they feel is truly for them. What is patient advocacy? Patient advocacy ensures that the patient's voice remains central to the care process. This is especially important for individuals who may not fully understand the system, who face linguistic or cultural barriers, or may hesitate to ask questions. Strong advocacy is not optional. It is a hallmark of high performing healthcare organizations. It protects patients, supports clinical teams, and reinforces our commitment to ethical and equitable care. Why culture matters is in healthcare. Culture influences nearly every decision a patient makes, how they interpret symptoms, whether they trust a provider, and how likely they are to follow a treatment plan. If we fail to acknowledge these realities, we increase our risk for miscommunication, avoidable complications, and decreased satisfaction. If we respond to cultural needs proactively, we accelerate care quality, strengthen community trust, and motivate operational performance across the board. The Institute of Medicine Unequal Treatment report made it very clear. Disparities in care are real, measurable, and preventable. Culturally responsive care directly addresses these disparities by improving provider patient communication, strengthening diagnostic accuracy, and increasing adherence. For us as a board, this matters because disparities affect quality metrics, readmissions, length of stay, patient experience scores, and community reputation. By leading on cultural responsiveness, we position our organization as a regional leader in equitable care. Improve outcomes. We know from evidence and from our patient experience data that when patient feels understood, their outcomes improve. Culturally responsive care is linked to low readmission rates, improved chronic disease management, higher patient satisfaction, and better maternal and infant outcomes. These outcomes are not just good for patients, they reduce risk, reduce cost, and strengthen performance in value-based environments. The CLS Standards Overview. To guide organizations nationwide, the Office of the Minority Health created the CLAS standards, a nationally recognized framework for equitable and appropriate care. The standards emphasize these three areas that align directly with our strategic goals: a diverse, well trained workforce, robust language access services, community partnership, and continuous improvement. These standards are increasingly used in accreditation, compliance reviews, and federal quality expectations. Strengthening alignment now positions us for a long-term success. Why our organization must improve? There is a strong business case and an equally strong moral case for enhancing culturally responsiveness. From a leadership perspective, doing so well enhance patient trust and loyalty, reduce communication related harm, strengthen staff engagement and retention, improve our competitive position in a diverse market, align us with national quality and mandates. In other words, this is not an add on, it's a strategic advantage. The importance of strong patient advocacy. Patient advocacy is the bridge between patients and their care teams. When we strengthen advocacy, we ensure that every patient, regardless of personal background or health literacy level, receives care that reflects their goals and values. For leaderships, this translates to fewer grievances, fewer avoidable complications, and stronger relationship with the community we serve. To conclude, I'd like to highlight four strategic actions that will support our long-term success. Invest in continuous training, enhance language and interpretation services, ensuring no patient faces a barrier to understand their care, deepen our community partnership to better understand and address local needs, and use data to identify disparities, minority outcomes, and measurable progress. By committing to these steps, we fortify our organizational culture, elevate our quality of care, and strengthen our trust with the community we are privileged to serve. Thank you for your time.